Good morning, everybody. We are doing our Tasty Tip Tuesday, and today I'm going to be talking a little bit about supplements. Now, I'll be honest, there are so many supplements out there, there is just no possible way I can hit them all. So I'm just going to kind of focus on the main ones, and I know there's a few people in this group who have like specific concerns and needs, and so I really want to try to hit on, I guess, what would be most beneficial for the specific people in here as well. Okay, so when you go to the drugstore, you're gonna see every vitamin, mineral broken down into each individual one, and so that's what I mean. Like, I can't cover everything, and honestly, a lot of that stuff is not necessary. There is a lot of overdoing, I think, especially when it comes to like our B vitamins and vitamin C, all of those water soluble vitamins. Our bodies can only absorb so much of those things, and if we just take excessive amounts of them, we just end up having really expensive urine. We just basically pee it out. And so I think we can cover a lot of our general nutrition with some basic vitamins. Okay, so first one I'll talk about is just a general multivitamin. So this is not required. This isn't something that everybody needs. It's a supplement. Okay, so if you feel like you eat a really balanced diet and you're getting lots of your fruits and vegetables, lean proteins, you may not need a multivitamin. If you feel like your diet is still a little patchy, you're still working on improving that, you know, a multivitamin can definitely be a great thing to add. And it doesn't matter really what form it's in, chewable, liquid, pill, capsule, you know, just your basic standard multivitamin. Okay, so Centrum, Women's One a Day, Nature Valley, there's lots of ones out there. Anyone from the name brand to the generic is fine. Might want to consider getting one with iron, since we're all women in here, especially if you do have periods every month. That extra iron will kind of help during that time that you tend to be losing more iron. So the only other thing I would say about multivitamins is if you are breastfeeding, you want to continue taking a prenatal vitamin for the whole time you're breastfeeding. If you've just recently had a baby, it's good to keep taking your prenatal vitamin for at least 3 months if you're not breastfeeding. And if you are trying to get pregnant, I know there's lots of girls in here, and I don't know who is and who may not be, but if you are, you should really be taking a prenatal vitamin, because in the very first weeks of pregnancy, your body is going to need that folic acid before you even really know you're pregnant. And so that prenatal vitamin is going to give you an extra boost. And a prenatal vitamin is also something you can take as a general multivitamin too, if that's what you prefer. Time of day as far as multivitamins go, vitamins are best absorbed with other nutrients, so you know it can help to take it around a meal time, but it's really whenever's convenient for you. I know for me personally, if I'm taking multivitamins, I get really sick if I'm taking them on an empty stomach. So for me, it always worked better in the evening after I had eaten throughout the day. But it's just really whatever works for you and whatever you're going to stick to. The other thing that I would recommend is, and again, it's not necessarily required if you're getting a balanced diet, if you're eating good sources of calcium, but it's not a bad idea for women to be on a calcium supplement with vitamin D every day, just because we are at a higher risk for bone loss, especially as we get into menopausal age, and we tend to lose a lot of calcium from our bones as we get older. So general recommendation for that is going to be 1,000 to 1,200 milligrams per day. Like I said, I would definitely recommend having that be included with some vitamin D. 1,000 units on that, 1,000 per day on the vitamin D. And It doesn't matter necessarily what form. Like for my patients, I typically recommend calcium citrate because it doesn't need a real acidic environment in the stomach to be digested. It's the best absorbed form, but it's not necessary you do that form. You could do calcium caltrate, you could do Bioactive, Citracal. So again, there's lots of really good calcium supplements out there. And so those are kind of the two main across the board that I would say. I personally actually don't take anything because I'm doing Shakeology, and Shakeology has basically your multivitamin in it. So I don't feel the need, and my diet is pretty balanced, so I don't really need to take anything extra. But, you know, if you feel like there might be gaps in your nutrition, those are two to consider. Okay, so I want to get into a few specialty things. So first of all, if you are doing more of a plant-based diet, vegetarian or vegan, you definitely want to be taking vitamin B12. So vitamin B12 is really only found in animal products, and so you might be missing out on some really important nutrients that you want to fill the gaps in there. So good multivitamin and B12 as an extra supplement if you are on more of a plant-based diet. Okay, two more I'm going to talk about just because I don't want to bore you all day with this. Probiotics. So there is a lot of good research on the benefits of adding probiotics into your diet. So one of the things, basically a probiotic is live good bacteria cultures that are naturally found in the gut, and you know, for various reasons they can tend to get off kilter, and so supplementing with a good probiotic is again another good thing that you can do, especially if you're dealing with certain issues. So for one, like I said, it does help balance out the digestive system and helps promote the production of that good gut bacteria. Helps to treat diarrhea, especially if you've been on antibiotics. I know I was just on an antibiotic. We're in the midst of cold and yucky, icky, sick season. So that's something you can do even if just during the time frame that you're on the antibiotic. But even if you have diarrhea issues unrelated to antibiotics, a probiotic can help with that. It also can help lower the bad cholesterol, so it keeps your heart healthy. It can reduce certain allergies and eczema, especially in kids. So if any of you have kids that have eczema, there is some research that can connect to giving your kid a probiotic and helping with that eczema. And if you're taking probiotics during pregnancy, there's actually research showing that it reduces the likelihood of your child getting eczema after they're born. So that's another benefit as well. If you have any conditions that are related to the gut, so ulcerative colitis, there is some research that probiotics can help reduce the symptoms of ulcerative colitis and irritable bowel syndrome. I know one of you in here deals with some IBS, so that might be something to consider if you're not currently on it. The only thing it really does not be shown to help with is Crohn's. Okay, so that's in a whole different category. Probiotics can also help boost immune system, so they do help the production of antibodies, and they also inhibit the growth of that harmful bacteria, which can cause us to get sick. And then it also actually can help promote weight loss and reduce belly fat, and that is just because it helps keep you full longer, it helps you burn more calories and store less fat. So that's kind of related to the hormones. So probiotics, the only thing about them is some of them can be destroyed by the acid in the gut before they really even get into your system. So you want to make sure that you're getting an adequate amount. And that's going to be, it sounds like a lot, but these are like live organism culture. So 1 billion to 100 billion CFU per day is what you're looking at. And there are a ton of different probiotics and different strains. And different strains are good for different things. So if this is something that interests you or you're curious about, I can definitely give you more specifics on exactly what you're looking for in a probiotic. And again, it's not something I take because Shakeology, the shake I'm drinking every day, has actually prebiotics, just another topic, and probiotics in it. So I'm getting that in my Shakeology as well. Okay, the last thing that I want to talk about is omega-3 fatty acids. So There's lots of benefits to these as well. This is those really good healthy fats that are often found in high-fat fishes like salmon and tuna. So one of the things that's great about them is they do help reduce triglycerides. Another thing is they do help reduce rheumatoid arthritis, and they can also help with certain conditions like depression, anxiety. They can be a really good mood stabilizer. And then also, again, when it comes to baby development, they're really, really good for brain development in the formative years. And so if you, again, are trying to get pregnant, getting either a prenatal vitamin or taking a separate vitamin of DHA, that's kind of the one that's really good for baby brain development, is something that can really help during pregnancy, and again, if you're breastfeeding afterwards. So these are the ones that are more proven, that have a lot more research backing them than some of the other supplements. I'm not going to get into glucosamine because I'm already taking up a lot of your time, but that's another one for joint pain and things like that. So if you have any questions about vitamins, let me know. Sorry it took so long today, but there's just so much information. I wanted to make sure that I got as much to you as possible. So have a great day.